Hi, and welcome to the Adversity Psychologist Podcast. It's Friday. I just wanted to do my recordings. And today I have Sarah Swan with me, who is a clinical psychologist. Would you like to introduce yourself and tell us a little bit about what's brought you on today?
Yeah, thank you, Tara. It's a real pleasure to be here.
Nice to have you.
I'm a clinical psychologist. I qualified in 2000, so been a clinical psychologist for quite a long time now. Worked in the NHS up until 2019, working in mental health services and addiction services as well.
Right.
And then I made the leap in 2019 for a variety of reasons, actually, into independent practice.
Yeah.
So now I work with clients in therapy, and I do some expert witness work, and I also work with businesses around employee wellbeing, and I do supervision and coaching of other psychologists. And what else do I do? And
all sorts of stuff.
I work for the Association of Clinical Psychologists as well. Lots of different activities, which is what I love. I love being busy in that way. But in 2019, 2 weeks after I resigned from the NHS, fantastic timing, I was diagnosed with breast cancer.
Right.
And that's what's brought me on to your podcast today. So, as I'm sure you can imagine, really, really difficult journey. But what I did as I finished that journey was decide to write a book about my experience. And I had, found the journey really emotionally difficult, and was struck by the fact that I had fantastic medical treatment on the NHS through COVID. And I was so lucky that my treatment wasn't affected in any way. And then, I just can't praise the staff and the services enough. But
it's wonderful to hear.
But in terms of emotional well-being, I really felt that wasn't explored very much.
Okay.
I felt I was struggling so much with it all emotionally, even with all my years of psychology training and supporting people with emotional well-being. I was finding it really difficult myself. And I was really having to draw on my skills of acceptance and commitment therapy. That was just such a powerful model. And so I thought, gosh, if I'm really struggling with this, then what must it be like for people who don't have this kind of training? And then kind of thought, well, actually, this is quite a unique perspective to be able to share my personal experience as well as how I used my professional skills. So, an opportunity came up with the Association of Clinical Psychologists and Sequoia Books. And so I agreed to write the book, which is now out, as well as becoming the series editor, because actually I decided there could be a number of clinical psychologists who'd gone through difficult situations who could also share their stories. So so that's also what I'm doing now, which is fantastic to see so many other clinical psychologists sharing their story and producing books that are going to be so helpful for people.
And we've had Yvonne Wafton already, and we've got some of the others lined up to come on the podcast too, which is great. And I guess one of the things we were just talking before we hit record, weren't we, that there is kind of a kind of a new stance now in psychology, I'm noticing, of people starting to share some of their own personal stories and journeys. And I don't know what your thoughts are on that. In terms of, it's a kind of fairly recent thing, isn't it?
It is, absolutely. And it was something that, even though, my values were telling me, write this book, you've got something to offer here. There was this other part of me that was, really scared about doing that. And sharing something so personal when, really we're trained not to. And and we have a writers group for the series. And that's been a lot of the discussion in that group is people's concerns about that, and getting it right in terms of sharing enough so that other people can benefit, but not too much, so that it doesn't leave you feeling too vulnerable.
Well, absolutely, as I say, because people are practicing as well. We qualified at a similar time as well, so I wonder whether as generations go on, that kind of professional boundaries, it's important, isn't it? But also what I'm really hearing is that how important it was also for you to get your story across, because you'd also seen a gap in need in terms of that emotional support as well. And I'm a huge advocate for acceptance and commitment therapy. And I wonder whether actually it might be useful for listeners, because some people I have talked about it before on the podcast, but whether it'd be useful to just kind of roughly say kind of what is acceptance and commitment therapy, because people may not be familiar.
Yeah, sure. Well, do chip in, Tara, because you might have a better way of explaining it. But I think about it as, in popular culture, there's often this tendency now to just try and think positive, and, to be happy. There's this pressure to be happy, but actually, it's part of the human experience to have a full range of emotions. And if we get into trying to struggle with those and push them away and avoid them, it can actually increase our distress. So in ACT, it encourages us to actually become aware in the present moment of what we are thinking and feeling, to open up to that, and then to think about what's important to us in terms of how we want to live our lives and what we can do to move towards that, despite all this difficult stuff that we've got going on. And I think that's really important in something like cancer, because it can easily take over your life, and your life can be run by cancer and all your medical appointments and all your fears about it, and so being able to hold on to what's important for me. How do I want to show up during this awful period in my life? How can I hold on to things that were important to me before? And in what small ways can I still be living by those values? There's a real kind of adjustment in terms of what you might expect of yourself. I like a lot of clinical psychologists, I think, have quite high standards for myself, very driven. It was important for me to continue to try and work as much as I could, but I also had to prioritize self-care in a way that I hadn't ever before, I think.
There's so much there that I'm sure will resonate with many people. When you really value, because ACT is very values driven, isn't it? And I think that's what I love, is helping the people that I work with just understand the difference between values and the goals that they might set themselves, and how perhaps we can sometimes get a bit deflated when we don't reach those goals. But it's really handy to kind of be aware of the values that might underpin them. But part of values is sometimes what we do for a living, and what's coming across really strongly is that there's a lot of value around what you do, and how you kind of navigated that with the cancer as well. And are you comfortable sharing a bit about your journey? So kind of maybe from your perspective, what some of those roadblocks were, particularly emotionally, what you needed.
So I received a diagnosis in 2019, and it'd been an illness that I'd always kind of feared, but never thought it would happen to me. And even though I had these symptoms, I was still telling myself, no, I'm sure it's fine. I think I put off going to the GP because it's so difficult to get an appointment alongside working, and all that stuff. Went to the appointment by myself, saying to my husband, no, it's fine, you don't need to come with me. Received the news. Well, they said we're pretty sure, even before we get the biopsy results back. So
right,
complete and utter shock. And so, the first challenge was, what do we tell the children? So they were 11 and 14 at the time.
Right. Yeah.
So that was really difficult. So we waited until I had the diagnosis confirmed.
Right.
And then, I obviously straight away, there's all those fears of, well, first of all, is this life-threatening? And secondly, what I know about cancer treatments is not pleasant, and, what am I going to have to go through?
Yes.
And what I feared most was having to have a mastectomy and not being able to have an immediate reconstruction, and having chemotherapy. They were two things that I really didn't want. And I had to have both of those things as well as radiotherapy.
Right.
The chemotherapy I found really, really tough. It really wiped me out physically. I was having fortnightly treatments. Again, I suppose the other thing was, I kind of didn't realize how many different types of breast cancer there were, how many different types of treatment.
Yes, yeah.
People tend to think it's, a single thing and this is how it's treated, but there's so many sort of variations. So my chemo was fortnightly, which meant I had a good 7 to 9 days of feeling really pretty rubbish, and then a few days of feeling well, and then I'd have to go in again. And so it was really difficult for me being that kind of physically vulnerable, as well as emotionally vulnerable, and having to rely on my husband to do the bulk of the childcare and the cooking and all of that stuff, to allow friends to help us out. And then on my days when I was feeling well, I had to financially, but also wanted to do some work. So during those days of feeling well, I was trying to cram in some work, try and do some things that I enjoy, try and connect with friends.
The value-based stuff.
Yes, exactly. That had to be squeezed into those days, because on the other days I was just going to be in bed and watching Netflix, really. There might be really small things I could do on those other days, but for someone who is usually so busy, and
I was going to say, was that a bit of a shift?
Yeah.
In terms of what you're used to?
Yeah.
And coming back to that earlier point you said about, the kind of that being vulnerable, that being able to press pause and stop from a busy life.
Yeah. And so many times I question myself, am I just being lazy? Or, am I actually getting depressed? So should I make myself do stuff? But then, no, a couple of days later, it'd be like, oh no, okay, it's lifted. I can do stuff again now. And so just learning to be kind to myself, and realizing actually how hard I have probably always driven myself before.
Yeah. So a bit of kind of reflection. Because often when we press pause, it can mean that we have time to then reflect.
Yeah.
Because what is really interesting, actually, there's so many things there, but just obviously the amount of information that you have to absorb and weigh up to make decisions about your treatment. So from what you were saying, about different type, I am spectacularly ignorant, actually, on different type, and I hadn't thought until you'd said it, in terms of, obviously, as psychologists, sometimes we help people when they feel overwhelmed and they've got decisions to make, is how you process all of that information when you're overwhelmed, when you're in a bit of threat mode, when there's fear affects life, and you've got, your mind racing forward to what will, children to consider, but just also then that ability to navigate all that and press pause and go, what do I need and what don't I need right now?
Yeah.
So much there. That's probably more than one podcast episode, because I'm wondering if that kind of led you to start to think, what if you don't know this stuff? What if you're not averse in acceptance and commitment therapy and not able to even catch those hooks and bring us back,
Yeah. And of course, there were times when I didn't get this right.
But that's important to get across as well. That's what I get across now, that, even experts in a particular type of therapy, we're human too, and we're not going to catch the stuff and get it right.
Yeah, no, absolutely. There were times when I sort of allowed my anxiety to run away with itself and to get hooked by all those thoughts about what this meant about the future, or the, you know, imagining all these awful things in the future, and finding it really difficult to get myself out of that. And you know, whereas connecting with others is such an important value for me, I was at times disconnecting and feeling like I just wanted to isolate myself. And I'm normally, really responsive to friends' texts and things, but I was, avoiding replying to people, so of course that was leaving me more caught up in my head.
So as you say, it can be quite cyclical then.
Yeah.
That's it.
Yeah. Going down that rabbit hole. Yeah.
And I guess
actually I remember, oh, sorry, go on.
No, you go.
I was just going to say about, I just recalled something I wrote about in the book of finding myself in that position one day, and my husband was out, although he mainly works from home. And I eventually just recognised that I've got to do something different here. I'm just really spiralling. Right. And I messaged a friend and said, I'm really struggling. Would you mind coming over? Yeah. And I think that was the first time I'd probably ever done that so explicitly. And, she was there in a few minutes. And as soon as I talked to her, I could take a different perspective on my thoughts and kind of come back to the present again and realize, okay, no, right here, right now, it's okay. I can get through this. And actually, I don't need to worry about all of that stuff because I don't know how the future is going to play out. I don't know what I'm going to be dealing with.
So I sometimes refer to that with the people that work with, kind of trying to catch those thoughts. Because sometimes we can really shy away from what's up there. I'm not sure I want to know. We might busy ourselves or maybe do some other unhelpful behaviours to kind of keep the stuff at bay. But actually, if you can gently kind of lean in what you feel to what you think, that's the kind of premise of that. Actually, that stuff that then doesn't seem quite so powerful in terms of that we need to respond to it right now. And the brain's really good, isn't it, at going, hey, give you these thoughts and you need to respond to this, right now. But it takes a lot, doesn't it, to be able to catch that and go, actually, no. But also bringing in your earlier point that for you, if you're someone who's really used to running your life, being super busy, what it's like to kind of lean in, be vulnerable and ask for help, that's okay to do.
Yeah, and I think it's, I felt I had to pick carefully those times to lean into it.
Yeah.
Because, whilst I was feeling physically very unwell from the treatment, it was just too much to try and lean into the distress as well. When my boys were around, I wanted to try and be there for them. And
so your kind of values as a mum.
Yeah. And so, it was finding those times on days when I felt okay physically.
Yeah.
And had some time to myself or just with my husband, that it was like, okay, let's really look at what's going on for me right now.
There's something about boundaries that's kind of come to mind for me as well, that actually you putting boundaries on that for yourself, whether that was actually useful for you, in terms of, you're absolutely right, that there are, we might not just have values in one area that come into play here. There's, values in terms of you and yourself and how you want to navigate treatment, but also values in terms of your children, your parenting, relationship with your partner. And because I guess one thing that really strikes me then is that something made you want to write this book. And I'm just thinking, there's so much knowledge that you have as a psychologist, you've got your lived experience. At what point, or was there a point even where you kind of thought, actually, what do other people experience going through this who don't have your training and your skills? Just wondering if was there a light bulb moment? How did that happen in terms of you identifying that need?
Well, in terms of the idea for the book, it came very early in my journey. Right. So I think it was in the first week of my diagnosis.
Really?
I was lying awake in bed, worrying about all this stuff. And I couldn't sleep, and I just thought, I just feel like I need to write this stuff down to get it out of my head. It's something we might often talk to our clients about, isn't it? And so I came downstairs, sat at this desk here. I prefer typing now than physically writing, so I just started typing what had happened over the past few days, trying to process it. And I kind of got to the end of that, felt like, oh gosh, that actually is a big weight off my mind. I'd actually managed to find a bit of humor in a couple of areas, sort of small funny things that happened during my hospital visits or whatever. And I wrote a line at the bottom that was like, maybe this could be a book. And I had the thought at the time, I really should keep up this writing through my journey, just in case I can make this into a book. I actually didn't do that. It just felt like too much on top of everything else. But there was that kernel of an idea. And even when the opportunity came up at the ACP and they were asking for ideas, that inner critic was like, no, don't say it. No one else will think that's a good idea.
And old imposter syndrome.
Absolutely. And I've never written a book. How can I write a book? So it took me a little while, and then I think I shared the idea with somebody in the organisation that I got on well with and felt safe with, and she immediately jumped on it. This is a brilliant idea. Let's think more about it.
And I think that seed was planted really early on. So I'm wondering whether part of that was about your own journey as well, whether it was helpful to start to write some stuff down, as you say, getting out of your head when it's swirling around.
By the time I came to write it, I had finished my treatment, and so I had another dilemma then of, do I want to? It means going back and revisiting all that stuff. So I did have a real wobble then of whether I was going to go ahead and do it. But again, I was led by my values, and being able to help someone, even if it just helped one person, it felt like it was worth doing. But actually it was, I think, a cathartic experience to go through it. And there were days when it was really, really difficult, and actually it was helpful. It made me realize actually there were maybe a couple of sticking points for me. Because actually every time I came to write about that, I'd find the tears were rolling down my face. And so I did get some therapy as well to help me with those aspects that I realized I hadn't fully processed.
So there's the kind of you sharing your story and the hope, obviously, that in itself is helpful for other people. But I was also really interested what you said at the beginning today, that you kind of noticed gaps. Obviously, that you said the physical treatment was remarkable, but there was something that you couldn't quite put your finger on about the emotional journey and the support.
I think though there's often a nurse in your appointment with the doctor, and you spend time with the nurse after, which is really, really helpful. And they do inquire a little bit as to emotional well-being. And it was, I would say, variable. Some were more skilled than others, I think, at being able to just sit with that distress.
That's important though, isn't it?
But at other times I felt like they couldn't sit with that, and there'd be a kind of I'll just go and get you a glass of water if I was getting upset. I don't need water, but and then
a really good point.
And then at the end of my active treatment, so I went from having, so I'd had the chemotherapy, then a little break, and then radiotherapy, which I had every weekday for 3 weeks. So I had this really intensive treatment period. And then it's like, okay, we'll see you. I can't even remember the time scale now. Maybe see you in a couple of months, something like that. And it really felt like dropping off a cliff, that I'd been, had all this intensive treatment and, medical support around me. And then that's it, you're on your own. And then halfway through that period, I was sent a sort of questionnaire. And they said, we'll phone you to talk, go through this questionnaire yourself, and then we'll phone you and we'll talk through anything that you've kind of ticked off on here. I don't know if normally that would be done in person, but during it was COVID, it was done on the phone.
Of course,
But yeah, it was listing on there all the things like, you know, I'm worrying about my cancer returning, or I'm thinking about why I didn't seek treatment sooner. You know, I'm feeling anxious. I'm feeling like, you know, all very good questions to ask. And there I was busily ticking lots of these things and going, yes, this is exactly where I'm at the moment. This is really what I need to talk about. And then when they called me, and I started to go through all the items I'd checked, and I became quite tearful. She kind of said, "Oh, this won't do. This won't do. We need to get you sorted."
Okay.
And so I just felt, oh, I think what I'm experiencing is very normal. I don't think I need to be sorted here. I just need to be heard.
Kind of like a fix-it, problem-solving,
yeah,
slightly panic. Come on, let's get this. Yeah.
And so again, I just reflected that, you know, as a psychologist, I can say, no, this is normal stuff. But if you don't have that training, then you might be left feeling like, gosh, I'm really not coping, or I'm really wrong to be feeling like this. And of course, as well, people around you at that stage are saying, you must be so relieved, you know, it's all over now, you can put it behind you.
Yes.
But actually, I felt that was the start of the emotional journey, the start of the actually processing what I've been through, because before then, most of the time, I just had to focus on getting through the physical treatment. And understandably, people, you know, don't anticipate that and don't get that.
They kind of put in their own kind of judgments and things on, but it doesn't necessarily make it okay to be received, does it?
Yeah, absolutely. And I think this is similar elsewhere in the country, but linked to my NHS hospital, there was a cancer support centre, where you could access counselling and some complementary therapies and things. I think I went along for a reflexology session or something early on.
We have one locally,
but partly because of COVID again, I didn't really make use of that. And then when I decided that I wanted to get some support for myself, I kind of felt, with my training, I wanted to be able to choose who I went to see and their qualifications and skill level, etc. But also I felt, I am in a position to be able to pay for it. And so I decided I wanted to do that.
Well, that's an important point as well, isn't it?
Yeah. But no, there are, I think that it's either free or means tested or something. So there is some support there. But even with that kind of support, it's still only a small number of people will end up making use of that service, I think. And as I say, I think I was worried that people might not access that because of their own judgments, which may be reinforced by others around them, that it's in some way wrong to be feeling this way.
Especially because that latter point you made, that you must be so relieved now. So by the time, when you've got a big life event, sometimes you're just dealing with the logistics of physical, right? What does this look like? What does the physical treatment look like? And it's such an important point to remind people that's not often the time that your brain's going, hang on a minute, let's check in emotionally and what am I going to need on that level. But if you're then surrounded by, often maybe well-meaning people going, oh, you must be so relieved now. What could that do in terms of being a barrier to you going, actually, maybe I want to talk to somebody? Feeling. And then we all know, don't we, as psychologists, it's really hard to get from thinking about it to finding someone, and that's hard. How do we know who we're going? And then to actually booking and getting for that first appointment,
even knowing what to expect, from that first appointment, it was still difficult for me as a psychologist to be sat in that other chair and
someone again, that kind of, I sometimes call it the control agenda. We're not used to being the ones on the other side, and so there could be a vulnerability with that, and that's okay. But what's really interesting, so kind of bringing into the book, the two big things that have stood out to me are just, and we see it a lot, don't we, that kind of fix it, problem solving, almost panic driven response that you had, which then could exacerbate in someone who's not able to catch it. I'm not doing okay. But then also that kind of second part of the journey, if I've kind of got that right, in terms of actually this is the time when I do want to reach out, but I might be surrounded by people making me feel I should be really glad and maybe moving on to other things now, that it's almost like a tick box, we've done that. And I think actually those are two really important things for listeners to take away. And is that, how is your book structured then? So somebody's sitting here now who may be at some point in their journey or supporting someone who is or who isn't, but is just interested. What is it about this book? Let us know. How is it structured?
So I kind of wrote it in a bit of a chronological order, really. And I structured it in a way that I felt people that could then dip in and out of it. Where to get the information they need at a particular time. So I sort of talked about, I've got a chapter on the diagnosis, then on telling people, and then on the different parts of the treatment. So I think I talked about, I'm trying to remember now, gosh, chemotherapy and surgery, and reconstruction. And then I did a particular chapter on body image. We haven't talked about that yet, but that was a really big part of it for me. So I had a particular chapter on body image, and then about that kind of managing anxiety in the future and kind of staying present. So, and then so I describe my personal experience, and then I describe how the acceptance and commitment therapy approach helped me at those different stages, or what skills I could have used now in retrospect. And
also being kind on that level as well.
I hope I got across that it's not easy to do what's going to be effective and helpful for us.
Well,
and being that I didn't always get it right.
Me, I'm just thinking that just that self-compassion, but how useful that is, because I wonder whether, and I don't know if it's a very British thing, isn't it? We've got to have it all together, or seeming that, we're dealing with everything life throws. But I'm just also thinking a point you brought in earlier, maybe if you're parenting or you're living with people, or you feel like you've got to, kind of be there for them, or put on a I'm doing okay. How wonderful to be able to read that actually sometimes that's not going to happen, but it's okay that we we are human and we can be vulnerable. We're not always going to catch that stuff. I think actually that could be quite profound for people to read.
I hope so.
And I think I love that point as well. He said that this is a book you can dip in and out of. That almost almost have a relationship with that book. I'm just thinking if there's anybody listening to this podcast who's at the beginning of their journey, actually how helpful that may be to know it's there when you need it at different stages as well. I think actually that would be really helpful for people.
Well, there was a book that I really drew upon, which was I think it's called The Complete Guide to Breast Cancer, which is written by two medical doctors who themselves have had breast cancer, and that's talking about the medical treatment. And there is a chapter actually on emotional well-being, but I found that so valuable. And I started to read it cover to cover, but then it was like, no, this is too much information. So when I'm going through chemotherapy, I'm going to read the chemotherapy chapter, and then when I need to read another chapter, then I'll come to that. And so I found that helpful, so I wanted to offer that myself in my mind.
That knowing it's there. Sometimes, well, actually, in psychology as well, sometimes, when we're doing kind of trauma-informed work or debrief work, sometimes people don't always need to call up or use that kind of service, but there's a huge evidence base that people know it's there, actually, with their distress and their kind of progress. There is something magical about ACT, I think. It's for me, I remember first being introduced to it after using cognitive behavioral therapy for many, many, many years. But just how even in the most sticky, difficult moments, you're able to come back to what matters to me in this moment. And you made a really good point earlier. It doesn't have to be a really big thing, that there were some days you mentioned that just a tiny thing that you could do for yourself.
Yeah.
But why is that? Because I'm just thinking how we can maybe get that across to people who are new to this approach. Why that is so helpful, because it really is, but it's quite hard to kind of put into words, isn't it, sometimes?
Yeah. So I guess, my default position when on those days when I was feeling really rubbish from the treatment was on the sofa watching Netflix. And don't get me wrong, I love a good Netflix series, and that can be self-care, can't it? Sitting on the sofa, a nice cup of tea and a biscuit and Netflix.
And a series of Selling Sunset. Self-care in a nutshell, isn't it? Are we allowed to say that?
The ultimate in escapism. Yeah. Absolutely. So, I'm not knocking that, but you can definitely overdo it. And, I really didn't feel like doing anything else on those days. But if I got to the end of one of those days, only having done that, I would be feeling even worse. And so, probably the two main things I would try and do is get outside, even if it was just for a walk around the block. I've got 2 dogs. My husband was taking one of them on a proper walk. The other one is very elderly, so bless him, he would come on the walk around the block and be quite happy with that. And just that, getting out in the fresh air, just moving a little bit, just trying to do that mindfully as best I could, just to engage with my surroundings. I'm lucky to live in the countryside, so just observing the nature and feeling the wind on my face.
Being out in nature, but that rhythmic movement of left right, there's quite a lot of neuroscience, isn't there, around that, helping you process emotions, decision making, all sorts of things.
So I would try and do that, and I would try and spend even just a few minutes just trying to be present with my children, talking about their day, or helping them with a bit of homework, or playing a game, or whatever it was. Just
thinking that if for people who may be new to ACT, that when we talk about kind of being in the present moment, we're talking about, as you look at your watch in this moment, what can I manage with that person, with that child in front of me? And that may be something really small, it could be something a bit bigger, and it doesn't really matter what it is. It's that catching it, isn't it, and being in the here and now.
Because it's it was so easy to notice all the things that I wasn't doing. Oh gosh, I'm not providing.
We have a lot of routines, don't we? Instructions. It's okay to say when we're parents, there's so much. I'm actually thinking then, that does that trigger more in terms of the absence of not being able to do some of those things?
And it highlights all those expectations we might hold, in terms of, oh gosh, I haven't cooked a home cooked meal for them this evening. They're eating brown food again, and then sort of, I can remember times of lying in bed feeling really unwell, hearing my husband trying to kind of manage some kind of conflict between the children, or and he and my youngest are quite similar and can clash sometimes, and I'm often the referee that has to come in, and just knowing, I know I could ease this process for them both if I were able to step in, but I just physically can't do it right now, and just having to let them find their own way of getting through that. And so it can just make you aware of the expectations that you hold, but how much you're just not able to do that is within your your values, what you'd really like to be doing. But so accepting that actually all I can do is spend 5 minutes with them is hard, but spending that 5 minutes is better than none at all.
Because I'm wondering then, and you may not want to bring this in, but whether some people, the brain can be really good at then telling us off. It's almost our worst enemy sometimes at times, isn't it? That I shouldn't have done. What does that say about me as a parent? And kind of how useful acceptance and commitment therapy can be to try and catch those kind of thoughts,
definitely.
If you're noticing that you can only manage 5 minutes. Because the brain's great, isn't it? Coming in at the worst of times with the you are or you're not.
Yeah.
You know, parenting's hard at the best of times anyway, isn't it?
Yeah,
Really
absolutely. Yeah, and that reminds me, I talk a little bit in the book about gratitude as well, and so just trying to be grateful for the 5 minutes rather than the.
I was just going to ask that. That's a literally perfect introduction. That gratitude work can be so powerful, can't it? So I'm thinking, if you've got that inner critic, you know, that brain saying, "Hey, you've only done. How do we reframe that? What can we do?" And for people that may be new to gratitude work, do you want to just tell us a little bit about what it is, how it works?
Yeah. So, you know, as you're kind of saying, our minds can so easily be drawn to the negative and what we haven't done and what's wrong, and of course, you know, if you're facing cancer, there is a lot that's
of course
difficult and unfair and all of that. So it's about consciously trying to tune in to what's gone well. You know, maybe each evening just thinking about, what can I be grateful for today? You know, what has gone well? What have I managed despite how awful I'm feeling? What might someone else have done for me today that I can be grateful for? You know, I mean, that was definitely something I learned through my journey, is actually how lucky I am to have so many people who wanted to be alongside me, and even if they didn't know what to say or what to do, that they were there. So that was something I kept trying to remind myself.
That was helpful for you, because I think that's another important point as well, actually. And while we've got people listening, that sometimes if you're supporting someone who's going through something difficult, we might feel a bit like we don't know what to do. And there is sometimes this natural tendency that we need to be able to fix it or problem solve. But actually, a lot of the time, that's not what people need. So it might help people lean in a bit more if they're listening. Because even if somebody's listening to this podcast and they haven't got a friend who's going through cancer, they may have a friend going through something different, that actually there's so much from today that might be useful for them, that actually just asking that person, what do you need? And it might just being with them. You know, you might not even need to talk, you know, that there are so many things.
Definitely. So I really valued people who offered specific types of support rather than just saying, I'm here if you need me. So for example, I had a friend who said, I would like to, rather than asking, can I, she said, I would like to cook you a family meal once a week. And my husband and I agreed that even if we didn't feel like we needed it at that point, when offers like that came in, we would accept, on the basis that at some point we probably would. And we're both the kind of people who, you know, don't like to ask for help, particularly in that way.
But that's important to bring in, isn't it? You know, that a lot of people maybe like that.
So she did that throughout after my mastectomy, I think. For about 6 weeks, and what a treat that was to have a lovely home cooked meal delivered to us with some instructions of how we can finish it off. And then, you know, I had other friends who, you know, would just listen. You know, I always found it very validating when people just said, that sounds awful and I don't know what to say. But that was enough to let me know they were there alongside me. And I had a friend.
A lot, isn't it? That's really, I think actually that will be very, I'm thinking, because actually acceptance and commitment therapy could actually be useful for the people who are supporting as well, when they're catching their own hooks about, I don't know what to say and I can't fix this. So that may mean that sometimes they don't lean in and ask or be present, you know?
Yeah, and I had a friend recently who said, I don't feel I was there for you. And I think she meant emotionally. But I said, actually, you were, but in a different way. Like, we did some fun things together, and that's just as important. And to, you know, to get together and not really talk about it. I needed that too. You know, I needed just to be me, not just a cancer diagnosis. And
that kind of helping you connect with the you rather than the you that is going through treatment or
Yeah.
Whatever it is that particular day.
Yeah.
I think that's actually quite important because, you know, people listening to this podcast that might be supporting someone in whatever capacity actually take a lot away from this and your book as well.
Thank you.
That kind of, what I'm thinking is that people are going to want to hear more is literally, we could almost do, I'm wondering whether maybe we need to do a double episode on this, get you back at some point, because there is so much more that I want to cover. Where do you hang out? Where can people find more about you? We obviously need to know, where is the book available? Let's do that first. And I'll make sure this is all in the show notes as well.
Okay, thank you. So you can get it through Sequoia Books, and I think we've got a discount code set up.
Oh, we have, yes. Do you want to let us know about that?
Yeah, so if you put Tara, I think we made the discount code Tara in the discount code box at the checkout, you can get 20% off.
Fabulous, thank you.
That's at Sequoia Books. Or you can get it through Amazon and leave me a review. That would be amazing.
Yeah, please do. It's so important, isn't it? It doesn't take long to do, and it's super easy, isn't it? And it does make a difference. So please, if you read the book, you buy the book, please leave a review.
There's a few lovely comments on there, so that's been really nice to read. So I'm not massive on social media, but I'm on LinkedIn and I'm on Facebook. So I can give you those links to put in the show notes.
Are you under Dr. Sarah Swan, or is it a different name?
I'm under Sarah Swan on LinkedIn and Facebook, under Sarah Swan and the Swan Consultancy.
Okay, brilliant.
Yeah.
I will make sure as well that this is all in the show notes, because one of the things I do know, people are more likely to click on if the link's already there. For it, and I always think that's great because show notes stay live, so you can alter them as you need as well. We have heard so many, honestly, I think we could almost do with another episode on this. We've heard so many just important things, but I always ask every guest, if there was one adversity takeaway, one little nugget that you could leave us, what would that be?
Oh gosh, just one's hard, but
I had someone do two the other day. That's okay. That's all right.
I think maybe that one's doing one small thing just each day. Yeah. What's important to me today, and what small step can I take towards that? Yeah. No matter how hard it is. Now. Yeah.
So no matter how hard it is, what small step can you take? And so if you're listening on a train, you're listening in bed, whatever it is you're doing, have a think about that today. Yeah. You know, what is that small thing that we can all do? Sarah, the time's just gone so quickly. And I'm sure I'm going to listen back and go, oh, there's more we need to do. So if you're happy, I'm definitely going to have to get you back on, because I think I've been doing a couple of 2 parts lately, because I think some particular topics and journeys, we just can't do it justice in one podcast episode. I just think, that people, I'm really, really glad that you felt able that you could come on and share your own story as well. So thank you for doing that. But also just how much people will get from this. So please just let us know the name of the book so people can have that planted in their heads, firmly planted in their heads.
Coping with breast cancer, how to navigate the emotional impact through your journey. Yeah.
So go check it out, guys. And we've got a discount code, so there's no excuse not to go do that. Thank you so much, Sarah. We will stay in touch. It's been lovely.
Will do.